Is recording now?
Okay. Yeah.
Yes. Today presentation about hypertension and COPD and meningitis. Subject. The patient is 64 years age, a male patient. He came by fever with chillings for 5 days, headache, and headache more in frontal region for 5 days, giddiness, and the weakness is not able to the walk, vomitings for 2 days, and breathlessness and cough with a mucoid, sputum more in the morning for 5 days. Abdominal pains for 5 days, chest pain also is for 5 days. Known case of asthma since childhood. Chronic alcohol for 40 years, smoking 30 to 40 years. The objective. Temperature body is 102 degree Fahrenheit. The pulse rate 90. Respiratory rate 19. Breath BP 160 per 99. Glucose 86.2. Protein 196.9. Chloride 117, WBC is 300. PCO2 49, PO2 70, HCO3 30, TCO2 31. Physical examination, neck stiffness is positive. Assessment. Based on the subjective and objective evidence, the patient was diagnosed to have hypertension and COPD and meningitis. Treatment goal for a COPD, to prevent or slow disease progression, to reduce signs and symptoms, to improve quality life of the patient, to improve exercise tolerance, to prevent complications, to prevent exacerbation of COPD. Meningitis. Treatment of meningitis include two main goals. Number one, eradication of infected organisms. Number two, management of CNS complication and systemic complication. Other goals include to maintain respiratory cardiology function, to prevent progression and recurrence of disease. Treatment patient. We have two types of treatment. Number one, non-pharmacology therapy. Number two, pharmacology therapy. The number one's oxygen therapy and lifestyle modification. For a pharmacology therapy, we have to tell anticholinergic drug, for example, ipratropium bromide 2 inhalations for 4 or 6 times in a day. Number two, beta agonist control dyspnea and improve exercise tolerance. Example, salmeterol and terbinafine. Number three, theophylline 400 mg per day. Number four, corticosteroid prednisone 240 per days. Number five, mucolytics or expectorant agents. For meningitis, empiric therapy should be initiated without any delay. During of the treatment, 10 to 14 days. Only use antimicrobial agent which have one bactericidal in nature. Number two, cross blood-brain barrier. Number three, give adequate CSF drug concentration. Drug of the choice, ceftriaxone 50 to 100 mg per kg. ampicillin 100 mg per kg plus cefotaxime 50 mg, ceftriaxone 50 mg plus vancomycin 40 mg per kg. The current regimen, injection ceftriaxone dose 2 gram IV twice a day is act as antibiotic. Injection rabeprazole, the dose 20 mg IV twice a day is act protein pump inhibitor. Injection ondansetron, the dose 4 mg IV SOS. Injection artesunate, the dose 120 mg IV once a day, stop after 2 days. The paracetamol dose 650 mg oral SOS. Tablet metoprolol, dose of 220 mg orally twice a day, stop after 2 days. Salmeterol, given as a neb every 6 hours. Budesonide, given as a neb every 8 hours. Salbutamol, again giving as a neb 3 times a day. Syrup of N-acetyl cysteines, 2 teaspoons oral twice a day. Cholecalciferol, 30 grams oral 3 times a day. Tablet prazosin, 2.5 mg oral as a 2 times a day, but a start date of a 3 administration. Tablet amlodipine, 10 mg oral 1 times a day, a start date 3 of administration. Problem identifications. The number 1, metoprolol and salmeterol. The metoprolol can cause narrow of airways, so it should not use in COPD. It can also trigger severe asthmatic attack. Number 2, metoprolol and budesonide. The budesonide may be reduce the effect of the metoprolol in lowers BP. Prolonged use of the budesonide cause of sodium and water retentions and of swelling their hand and feet. Metoprolol and food. Food enhanced to level of metoprolol, so should take at the same time each day and with or immediately following the meal. Avoid drink alcohol, which can cause drowsiness and dizziness. Number 4, budesonide and grapefruit. It can increase the level of the drug in a body. The number 5, artesunate, was given without indication. Patient counseling. To take healthy and vitamin-rich food, to avoid exposure to allergen and dust. Ceftriaxone may cause diarrhea, so advise the patient consult physician if severe. To educate the patient for proper use of inhalers. The educated patient to shake well before each use of inhale. To educate the patient to clean mouth piece of inhale. To advise patient to stop smoking and alcohol intake. Paracetamol not take with alcohol, it can take with full glass of water. Don't take grapefruit or juice of it. In the case of meningitis, personal hygiene is very important. Medication adherence, antibiotic, 10 to 14 days is too important. Avoid exposures to any infections agent or infected person. To advise patient to take sufficient rest. Thank you. It has my presentation. Anybody have a question?
See where you taken this template?
Sir, I can't hear you properly.
Where
From
you
where
have
you got
taken
this
this
template?
template?
This is where before hospital is become the stops. I find in a wing number 5 the case.
No, template. Not case.
I can't hear you, sir. Sorry, I'm sorry.
What is the problem? Is my voice breaking? You can stop the recording.
Your voice is so
No.
down. Wait 1 minute, I make it. Okay.
Am I audible to other person?
Yes, sir.
Yes.
Yes,
Is
sir.
it clear or low?
You go to the first slide.
Yes, sir.
No, this template where you have taken, we are asking just.
I'm making, sir.
You only done, huh?
You stop recording, Mona.
Okay, 1 second.
No, let her be there, no?
One is
No, you continue recording, no problem.
Continue. No problem.
continue. Okay.
Show us the slides.
Yes, sir. 1 second. Yes, it's a subjective.
Hey, this Varun Yadav is there, huh? Hey, Varun. Varun,
Varun is there.
ask him. He is only having background noise.
Yeah. He haven't muted himself.
Hello, Varun.
Yes, sir.
Hey, mute your mic, man.
Sir,
You
I
are not
muted. I muted.
No, you're not muted. Okay.
Can I just start the record?
Yeah,
Go
go
ahead.
to the
We'll have
slide.
discussion.
I do?
Go to your slide. We'll have discussion.
Okay, which slide?
Any questions from the students?
No, sir.
BP is 160 by 99. 99 also they will write, huh?
Yes, sir.
Yes, sir. They'll write, sir.
The WBC 300 written, is it
WBC is 300, sir. Like I'm not able to understand.
CSF?
So this is a CSF fluid, huh? Glucose, protein.
Yes, sir.
Yeah, it's meningitis case, no? It is CSF fluid.
Okay, next slide. Okay, next.
Which type of meningitis it is?
I don't know, sir, because actually it's not mentioned there. Which
And what
type.
is the cause for the meningitis in this patient? I'm asking. Audience?
Might be bacterial.
Bacterial
I think
meningitis could be.
Okay,
bacteria.
which infection? Is it bacterial?
Yeah, I think
Because
Antibiotics,
they did
sir.
CSF. They did CSF culture. Did they do CSF culture?
no, sir.
Okay, so based on CSF analysis, how will you differentiate bacterial and viral meningitis? How can you say that this bacterial, not viral?
It's a bacteria. I think because of the WBC is too high.
Mm-hmm.
Based on the neutrophil and lymphocyte count, actually, we can judge.
Differentiate.
If lymphocytes are more, then we can say
What's the
viral.
age of the patient? What's the age?
64 year.
64 years.
Okay, so geriatric. What antibiotic they give?
Yes. One second, I will show the prescription.
I think it's ceftriaxone, sir.
Ceftriaxone, yes.
Not sure. Ceftriaxone.
Only one, no?
Yes, sir.
Artesunate also. Why artesunate? Malaria.
Malaria, but without any indications.
No.
They're giving the
Initially, they might have thought malaria, I think.
Maybe
What
cerebral
were
malaria.
the evidence? What were the evidence in support of malaria here? Tell me some evidences that is supporting malaria, that is making you think of malaria.
So, but it at the same time it stopped after 2 days of administration.
Yeah,
By that time,
I'm asking what were the evidence that pointed towards malaria or that made the physician to prescribe artesunate in this case? What based on what evidence?
Not sure. Not sure. Could be like they gave like empirical or else like based on science or something like that.
EMP test was done.
Not sure about it. It's not done, I guess. It's not there.
Okay.
So when you will give that as this one, you have to give. See, person has to travel some epidemiological malaria area, or he should have earlier some malarial symptoms.
Severe malaria.
Only fever was there. Huh?
In case of this artesunate, is a choice of cerebral malaria actually. So it is a meningitis again related to brain. Okay, so that's what made me thought like what is there any symptoms in the patient or any evidences that made to think physician about malaria. Artesunate is drug of choice of cerebral malaria. Okay, like to save the patient from complication of malaria. So here, does the physician thought that this meningitis is a complication of malaria or what? But again, after some time they stopped it. So maybe they ruled out that this is not a complication of malaria. So why the question is now why they started artesunate? I mean, what evidences pointed towards malaria?
Even chloroquine resistant malaria also they use the artesunate. But here there is no proper history was taken, I feel. Okay. But otherwise, why they have to start at artesunate here? Which class of drug is artesunate? What is his mechanism of action?
It produces reactive oxygen species
Oxygen radicals.
against the parasite. Yes, sir. There was metoprolol tablet showing that it stopped after 2 days.
Yeah, tell why
They
it is
added
to
trazodone, no? They added trazodone up on the day 3 of treatment is what she said in other slides.
He told there is an interaction. Metoprolol, it exhibits COPD in asthmatic patients. We cannot give. That's why they changed.
Salmeterol is also given. Salmeterol and metoprolol interactions he was talking about previously.
No, why they have to start metoprolol? Metoprolol is a drug of choice here for hypertension.
Might be she is using it previously, sir. Before
Even though
admission.
even if it is using previously, why we have to use? Patient is asthma, no? And why asthma patient also previously that is was this one? Asthma COPD. What was the BP? 164/99, huh?
Yes, sir.
99.
So 164/99 means almost 100. So it does not classify for this one also, no? Emergency, hypertensive emergency. So would have given any other even
Cilnidipine could have been given.
huh?
Cilnidipine would have been given.
Amlodipine is
Cilnidipine
given.
also. Huh?
Amlodipine is there, sir.
Amlodipine also is there. Go to the next slide.
1 second, sir. Amlodipine also is there.
So they have stopped this one and added.
Yes, sir.
But why specifically metoprolol is not this one? No.
I don't know, sir.
Hmm.
3 nebulizations there. Only long-acting and
Sir, I
short-acting
think
both.
salmeterol is also wrong dosage, sir. Every 6th hourly it's given actually. It's long acting beta 2, so every 12th hour dosage actually that one.
Yes.
Nebulization, no.
Every 12th hourly
Nebulization.
should be given, sir. Not every 6th hour.
A long-acting
Long
formoterol and
acting.
salmeterol.
Salmeterol and formoterol is like long acting actually.
Only salbutamol, they will give a 3 to 4 only.
Salbutamol is that is short acting, sir. But
Every
this
6
is
hours.
LABA actually.
Hmm.
So every 12th hourly dosing is required for this, not 6th hourly.
See, you have to check all this thing, no?
Yes, sir.
And also they're given L-acetylcysteine and also given paracetamol. Anything happens here?
No,
So
sir. That
cholecalciferol dose
tendency
I
is
have a
like
doubt. Hello. Cholecalciferol dose 30 grams. Don't know.
30 grams.
No, I'm seeing for the first time.
Is it comes in a sachet?
Yes, sir.
Oh, yes,
Sir.
yes.
And budesonide corticosteroids will be given twice daily, no, not 8 hourly.
No, initially 8 early and then taper to twice.
But cholecalciferol, why energy drink? Cholecalciferol is energy supplement. Huh?
Vitamin D supplement.
Hmm. Okay, go to the next slides.
Sir, and NSC also, like, is it OD dosing or BD, sir? I have a doubt in it actually.
Which one?
N-acetylcysteine.
Go back.
Actually, TID we should give. But
N-acetylcysteine 650 mg OD it comes, no, actually, not TID, I guess. 650 mg BD in the noon. I mean, OD in the noon it comes actually. Some as of I know,
Is it correct?
Two tablespoons BD.
How much it comes? 2 tablespoons means.
Anactalcin is syrup. No?
Huh?
It's syrup only. It's okay, I think.
N-acetylcysteine also comes in, which is 650 mg actually.
Here, this is syrup.
Syrup. I'm not sure, like liquid. I mean, in syrup, how much dosage it's strengthened.
Okay, go to the next slide.
It is right. NEC 600 mg BD for 24 hours. It's right, sir.
BD is correct. Huh? Why you put the metoprolol and salmeterol can cause narrowing of airway? Salmeterol also will cause, huh?
no, it's widening the airway.
Beta 2 agonist, no, sir. So it
Now,
dilates.
Mona, why you put both metoprolol and salmeterol and saying metoprolol will cause narrowing? Why you put salmeterol here?
You should know the answer, Mona. You are
Is it
telling
not
no.
drug interaction? No.
She want to tell that this is a drug interaction actually,
Yes.
because these have mentioned two drug, no?
Yeah.
So she want to tell that metoprolol inhibits the action of effect of salmeterol, I think.
No, whatever, whether it is combining with the drug or not, metoprolol definitely will cause narrowing.
That's what it antagonizes the action of salmeterol, like that she want to tell.
Oh, same way down also. Okay, next. How grapefruit juice will increase the budesonide drug level?
I didn't.
Huh?
Just I found as an interaction, and I found that one the grapefruit juice is bringing.
See, usually grapefruit juice is an enzyme inhibitor, no?
Yes.
So maybe it inhibits the metabolism of budesonide.
Yes. Sir.
Okay, any other questions? Okay, stop recording.
I think, sir, in patient counseling, one more point what she can add is mouthwash after using steroids. Sir. Like after inhale corticosteroids, they should do mouthwash so that in oral candidiasis and all.
Yeah, she has mentioned, I guess.
Oral can, yes, that is very important.
Mouthwash she didn't mention actually.
What is the patient counseling?
Mouthpiece and all.
No, she has mentioned. Go to next slide.
This one. The patient counseling.
Patient to stop. Clean mouthpiece of inhalation.
Clean mouthpiece of inhaler only she is saying. Next slide. All repeating some of the things. Not a grapefruit juice or repeating. Okay, it's not really there. Okay, so any other question?
In case of meningitis, like how many days subtraction should be given until the CSF culture comes or
Yeah, tell. Usually treatment is 10 to 14 days, no? But what is the criteria for to stop ceftriaxone?
I don't know that one.
What do you say, Sharath?
she didn't mention about the CSF cultures. I don't know. Like the patient wasn't properly followed up, I think.
Sir, the criteria is. Hello.
Tell.
Yes, sir. The criteria is depending on the CSF culture, sir. If the culture shows something sensitive to some other antibiotic, then they should stop the ceftriaxone and continue with that antibiotic, sir.
Yeah, that's how they do, no? Usually.
Yes.
Okay. Yes, Mona, stop recording.
Okay, sir. Just